Have you ever wondered if you're unknowingly taking something that could sabotage your health? What if I told you that doctors, the very people who prescribe medications to millions of people every day, often avoid taking certain pills themselves? Yet, these same medications might be sitting right in your medicine cabinet, and you could be taking them without a second thought. Imagine this: the medications you trust to relieve pain, help you sleep, or manage a common health problem might be slowly damaging your brain, increasing your risk of dementia, or even leading to a range of other serious health problems. Sounds terrifying, right? Well, today we're going to dive into the world of 5 common medications that doctors, with all their knowledge, steer clear of, but you might be using them without realizing the potential dangers. Stick around till the end, because not only will we reveal what these medications are, but we'll also share natural alternatives that can help protect your brain and your health. You won't want to miss this. This information could change your life and the lives of those you care about. Let's jump right in. Pump inhibitors, PPIs. You've probably heard of proton pump inhibitors or PPIs, especially if you've ever experienced heartburn or acid reflux. Medications like omeprazole, commonly known by the brand name Prilosec or esomeprazole, Nexium are household names. They're incredibly effective at reducing stomach acid and relieving discomfort. But here's the shocking part. Long-term use of PPIs has been linked to cognitive decline and an increased risk of dementia. Chronic use of these drugs can lead to nutrient deficiencies, particularly in vitamin B12, which is essential for brain function. They can also disrupt the gut microbiome, leading to inflammation that affects not just your digestive system, but your brain as well. One study found that people who took PPIs long-term had a 44% higher risk of developing dementia. That's a staggering number for something that's supposed to help with a relatively minor health issue, like reflux. If you've been using PPIs for a long time, it's worth asking yourself, is there another way to manage my reflux or heartburn? The answer is often yes. Dietary changes, weight loss, and natural remedies like ginger or apple cider vinegar can provide relief without putting your brain at risk. Benzodiazepines. Next on our list are benzodiazepines, commonly known as benzos. These medications are often prescribed to help with anxiety, insomnia, and seizures. If you've ever been prescribed Xanax, Valium, or Ativan, you've taken a benzodiazepine. But here's where things get tricky. While they're highly effective in the short term, long-term use of these drugs can wreak havoc on your brain. Studies have shown that people who use benzodiazepines for months or years are much more likely to develop dementia compared to those who don't. Why? Benzos work by slowing down brain activity, which can be helpful for anxiety or sleep problems in the short term. But over time, this suppression of brain activity can lead to permanent changes in cognition. Your brain essentially becomes dependent on the drug to function, and without it, cognitive decline sets in faster than it would otherwise. Now you might be thinking, but my anxiety is unbearable without them. What should I do? It's a valid concern, and no one is saying to just stop taking them cold turkey. But it's crucial to talk to your doctor about tapering off these medications slowly and exploring other, safer ways to manage anxiety or insomnia, like cognitive behavioral therapy or mindfulness techniques. Remember, doctors know the risks, and that's why many of them avoid long-term use of benzos. 3. Statins. Statins are widely prescribed to lower cholesterol and reduce the risk of heart disease. Medications like atorvastatin, Lipitor, and simvastatin, Zocor, are some of the most commonly prescribed drugs in the world. But here's something that might surprise you. While statins are incredibly effective at lowering cholesterol, there's ongoing debate about their long-term effects on brain health. Research suggests that statins may interfere with the production of cholesterol in the brain, which is essential for maintaining healthy neurons and cognitive function. Some studies have even linked long-term statin use to memory problems and an increased risk of dementia. Now, this doesn't mean that statins are bad for everyone. In fact, for many people, especially those at high risk of heart disease, the benefits outweigh the risks. But doctors who don't have significant heart disease risk factors often avoid statins, especially when there are other ways to manage cholesterol levels. If you're taking statins, it's a good idea to discuss the potential risks with your doctor, especially if you've noticed any cognitive issues. And for those looking for a more natural approach, Lifestyle changes like a Mediterranean diet and regular exercise can help manage cholesterol without the need for statins. 4. Non-steroidal anti-inflammatory drugs, NSAIDs. If you've ever taken ibuprofen for a headache or naproxen for joint pain, you've used NSAIDs. These are some of the most commonly used medications in the world because they're effective at relieving pain and reducing inflammation. But here's what most people don't know. Prolonged use of NSAIDs can increase your risk of cardiovascular problems, which in turn can lead to dementia. These drugs can cause high blood pressure, heart attacks, and strokes, conditions that reduce blood flow to the brain and increase the risk of cognitive decline. And it's not just occasional use that's the problem. It's when you rely on these medications regularly that the risks start to pile up. Doctors know this, which is why they often avoid long-term use of NSAIDs or only use them sparingly. So, what's the alternative? There are natural anti-inflammatory options like turmeric or omega-3 supplements that can help manage pain without the same risks. And if you must use NSAIDs, make sure it's only for short-term relief and not as a go-to solution for chronic pain. 5. Anticholinergic medications. Anticholinergic medications are everywhere. They're used to treat a wide range of issues, from allergies to depression to overactive bladder. Sounds convenient, right? But here's the kicker. Long-term use of these medications has been linked to a significantly increased risk of dementia. That's right. These medications block a neurotransmitter called acetylcholine, which is crucial for memory and learning. When acetylcholine levels drop, your brain's ability to function properly starts to decline. And here's a sobering statistic. Studies have shown that long-term use of anticholinergic drugs can increase the risk of dementia by up to 50%. That's a huge risk for something as seemingly innocent as taking an antihistamine. Now, you might be wondering, what specific medications are we talking about here? Some common examples include certain types of antihistamines used for allergies, like diphenhydramine, which you might know as Benadryl, certain antidepressants like amitriptyline, and medications for bladder problems such as oxybutynin. If you've been using these medications long-term, it's time to reconsider. Doctors often avoid these medications for themselves, especially as they get older, because they know how crucial brain health is. So why are so many people still taking them? The simple answer is, most people just don't know the risks. But now you do. So, what can you do about it? If you need an antihistamine or antidepressant, talk to your doctor about alternatives that don't carry these same risks. Or, if you're using them for bladder control, there are non-drug therapies that can help. Whatever you do, don't ignore this information. It could save your brain. Now that we've uncovered the 5 medications that doctors avoid but you might be taking, let me ask you, does this information change the way you view your medication routine? Are you wondering if there's a safer, more natural way to manage your health? The truth is, medications can be life-saving, but they can also carry risks, especially when used long-term without fully understanding the potential side effects. The medications we've talked about today, PPIs, benzodiazepines, statins, NSAIDs, and anticholinergics, are prescribed every day without most people knowing the full story. But now you do. So, what can we conclude from all this? The key takeaway is that we need to be more informed about what we put into our bodies. It's not about fear, it's about being proactive. Ask questions, do your research, and don't be afraid to discuss alternatives with your healthcare provider. Thank you for sticking with us until the end of this important video. If you found this information helpful, please hit the like button, share this video with someone who might need to hear this, and don't forget to subscribe to our channel for more eye-opening content. Until next time, stay informed, stay healthy, and take control of your well-being.